Hi, my name is Jamie Turley. I'm a physical therapist, and today we're going to be going through the Patellofemoral Pain Syndrome exercises. Today we have Jim demonstrating, and what we're going to start with is a quad stretch. And there's a couple modifications you can do. One is to simply stand holding on to something, whether you have a staircase rail or just a countertop. And you're going to bring your leg back towards your buttocks and hold with your hand at the front of the ankle until you feel a nice stretch on the front of the thigh. To give it a little extra stretch, you can lean forward at the trunk and pull the leg backwards. Good. And you're going to hold this stretch for about 30 seconds. And then you can come back up to neutral, let that leg relax, and repeat again 3 or 4 times. Okay, the next exercise is called the bridge. You're going to lay flat on the floor or on a firm surface, and you're going to have your knees bent and your hips flexed, just like Jim's demonstrating here. And you're going to lift up into what we call that bridge position, where you extend your hips straight, and at that fully extended position you're going to squeeze your buttocks together and hold for a count of 3 or so, and then come back down. You can relax fully, and then you're going to repeat that exercise 10 times. So the third exercise is called sideline hip abduction. And you're going to simply lie, in this demonstration, Jim's on his right side, so we're going to be working the left outside portion of the hip. And you're going to simply lift that leg straight up towards the ceiling. And it's important to actually bring that leg back beyond what you would imagine completely straight, vertical there, or excuse me, horizontal. And then you're going to bring that leg back down and then lift. And where you really want to feel it is on the outside of this hip through here. And if you are feeling it more on the front, that's usually a good indicator that you're too far forward with that leg position. Yep, nice and slow and controlled. And you want to squeeze these outside gluteal muscles up and down about 10 repetitions. So the next exercise is called a step up forward and lateral. And you can simply do this at a staircase or a small stool. Make sure the stool is nice and adhered to the floor. And make sure you have something to hold on to. So you'll simply step up. Yep. And then step back down, keeping that foot placed on that first stair. And it's important that you translate vertical on this exercise and not translate forward to where that knee goes over the toe. Good. And then a progression to this exercise would be doing a lateral step up. And so this would be obviously the opposite leg that Jim just strengthened, but for video purposes we'll use the left leg here. And yes, you just step up sideways. Again, here you don't want to lean forward or feel like you're leaning backwards either. It's just nice vertical movement. So the next exercise is called a wall sit. And so you'll simply find a flat wall, and you're going to put your back leaning up against that. Feet approximately 12 inches or 2 feet away from the wall. Then you're going to bend your knees to approximately 45 degrees. You don't want to go too low. You want to make sure you feel controlled and safe in this position. You're going to hold this for about 60 seconds. If you find this isn't too challenging, then you can add an ankle pump, where you simply lift your toes off the floor, like Jim is doing here, while you're sitting in this wall sit position. Now, if that is fairly easy, then you're going to add a small ball, something like this. You can also use a pillow folded up, and place that between your knees. And you're going to squeeze that at the same time as you lift those toes while maintaining this sit position. And this is, if you can go till fatigue on this exercise, that's great. So the last exercise in this series is called a plank. And this is a good core stabilization exercise. And so you're going to find, again, a firm surface on the floor is a great place. And you'll start, first, you're going to roll to your forearms. Put all your weight through your forearms just like this. And the first step is to keep your knees flat on the ground. And you want to engage your core right through here. You're going to keep that tight, and you're going to hold that position for 30 seconds. If that's not too challenging, you can progress this exercise by tucking your toes underneath yourself and pushing up to where your knees are off the ground, just like this. The important thing with this exercise is you want to make sure your body is completely flat. You don't want your hips to be coming up or to be sagging down towards the floor.